This is an old-fashioned one, so. Here, I'll give you another one.
Okay, I'm going to ask if you can all return to your seats, and we are going to get started again. And I just want to also mention that Dr. Levin will be signing your books over lunch. And we have note cards in your folders, so any questions that come up during any of the presentations, we are going to have a panel at the end of the day, because sometimes you have a question right after the speaker, and then as you go into the groups later, you'll probably find out you're going to have other questions that might come up for you. So please write them down, and we will be collecting them before we reconvene again, and we'll be reading your questions. So I would like to introduce to you now Valerie Jackson. And Dr. Jackson is an assistant clinical professor at UCSF Pain Management Center. She specializes in helping individuals manage their pain and live a fuller life. We all need that. She completed her fellowship in pain management at Stanford University and her PhD in clinical psychology at Alliant International University. Dr. Jackson also earned a master's in public health from Columbia University, a bachelor's from Stanford, and is board certified in biofeedback. She has expertise in cognitive behavioral therapy, dialectical behavioral therapy, DBT, and mindfulness interventions. So I'd like to welcome Dr. Valerie Jackson.
Mic here? No. Let's see. Okay, can everyone hear me okay? Yes. Great. Okay, thank you so much everyone for being here. I'm so glad to be a part of this today, and a special thanks to Eileen and Shirley and Helen to put this together and have me here as a part of it. So actually, I'm glad to hear that a lot of what I'm talking about was covered a little bit in one form or another in other sessions. So nothing like hearing it again to really let some of that information settle in. And we will have more time for Q&A in the afternoon. And also you'll be with myself and Dr. Gritzner in the afternoon for a breakout session. So we'll really be trying to give you tips and tools, a little bit of background, but really giving you tips and tools to work with. And we'll practice and discuss them in the afternoon. So also, who am I? I'm a pain psychologist. What that means is I'm a clinical psychologist, and I work specifically with people who have physical pain conditions, including a headache and migraine, and I try to help people live a better life and live a more full life and help cope with some of the things that migraine and headache can do. So I'd like to start with this quote from the American Headache Society. It's from their headache toolbox, and it really is just, we've already, Dr. Levin and Dr. Becker already said this, but headache is not merely a problem of the body or the mind, but rather a biopsychosocial disorder. It's a physical disorder subject to psychological and social influences, as well as environmental stressors. And so just a reminder, everybody in this room knows headache and migraine affects probably every area of life, or most areas of life at some point or another. So what we'll be talking about today is something I like to call a biobehavioral approach. We're integrating mind and body, just like Dr. Becker mentioned. I'll cover a few things, background on relaxation training, mindfulness approaches like MBSR, mindfulness-based stress reduction. I'll skim through the biofeedback part because Dr. Becker did a good job giving us that background already. I'll give a couple of examples of what it looks like. And cognitive behavioral therapy, just an intro, and then we'll have some tips and tools. So relaxation training. I like to use the word relaxation training because it's different from just relaxing. Sometimes we say, hey, just relax, take a deep breath, take a break. That's fine, but there's actually some amount of training and practice we can do to help turn down our body's stress response. A lot of what I talk about with my patients and when I'm teaching students, we talk about stress management. That really is what a lot of this is about. It's about stress management and learning training ourselves to be able to manage stress better. And pain and headache it's a stressor, right? So what is the relationship between stress and pain? I think most people in this room know that migraine and headache is a stressor. In itself, it's a stressor. So for some people, stress is actually a very clear trigger as well. How many of you, if you're open to sharing, find that being stressed, having a lot of stress in your life, affects your experience of migraine or headache? Yeah, most people. Stress affects sleep and mood. And we know that sleep, as our other presenters have spoken on, sleep actually really directly affects how our experience of migraine and headaches are. Also, pain is a stressor because pain is an alarm, right? Pain is originally, we have pain to alarm us to something not right. Like if you have your hand on a hot stove and you pull your hand back, pain's a good thing. It's stressful, and you want to know, you got to get your hand away from the hot stove. When we have sometimes pain that lasts, and pain is not giving us any information, like move your hand away from the stove, our body still reacts in the same way. And again, that's why we work to turn down this kind of alarm, this stress response. And the hope is that we can prevent, alleviate, and also cope with headache. So this is taking it back to high school biology for some, or maybe college biology. We don't need to go through all of it, but just to show that our stress response, including pain, causes something called the fight or flight response, or it activates the sympathetic nervous system. What happens is a whole bunch of hormones come out in our brains, things like cortisol, adrenaline. I like to show this acute stress response, public speaking, because that's something I'm doing right now, and I notice my own stress response. I might check in and see if my shoulders feel tight, maybe my palms are a little sweaty. And you might check in on your own acute stress responses with things like driving in traffic, experiencing pain. We notice things like, let's see if this button works. Yeah, like heart rate increase, deeper breathing, or faster. Actually, it's usually more like faster, shallow breathing. We might have mind and body hyper alert. You might notice your thoughts are racing. You might get shaky or jittery. A whole bunch of things are actually happening in our body. So, Dr. Beck already spoke about what is biofeedback. I'll speak about it a little bit as well. How many people in this room have heard of biofeedback? Wow, all right, great. How many have tried any form of biofeedback? Okay, more than half. Great. So that's helpful in that I won't go over it too much since most of you have an idea about this. But basically, biofeedback, the idea is to monitor and help recognize and try to control some of those headache-related physical responses, things like muscle tension, heart rate, sweat, temperature. Some of the evidence behind it, it's nice to know there is evidence behind it too. And we'll see that headache in adults has a very high level of efficacy, meaning research tells us biofeedback is very helpful. And there's a good amount of research to show that biofeedback in pediatric migraine is also helpful. And here, what we're looking at here is they did a 3-year study. So people completed some biofeedback training, people with medication overuse headache. And then 3 years later, they went and checked how their medication overuse was. And we see in people who just took medication, this is relapse and no relapse. Relapse meaning going back to medication overuse, versus medication and biofeedback. So for folks who got the biofeedback training, look how many more people did not have a relapse. 3 years out, that's a pretty long time, who did not have a relapse back to medication overuse. So it's not the cure to migraine or headache, but it can really assist, especially in combination with appropriate medication and other types of management that we'll be talking about. So this, just to show you what a screen looks like, this is what I do with my patients on the first time I meet them for biofeedback. I do a baseline stress test. Some providers just start with breath training. I like to do this. Whichever way you've done it is fine. What you can see is I'm measuring a whole bunch of different things like, whoops, well, there we go. Like sweat, temperature, we got some muscle tension and heart rate. Looking at all these factors, and I give people little stressors, not terrible stressors, I hope, but little stressors, like doing math or telling me about something stressful in their life, and just see what happens. Our bodies are all a little different. It's nice to know what happens in your body. Sometimes you're able to tell me right away. If I say, hey, what happens in your body when you feel stressed? Some people might be able to tell me right away. Like, oh, I get really sweaty, I get clammy and jittery. Other folks might say, I have no idea, nothing, I don't know. And as it turns out, something is happening in all of our bodies. So this is a really fun way to be able to take a look and then start targeting treatment. This is what some of the screens look like in terms of breath management, doing some breath training. You can see some folks, whoop, keep pressing the wrong button. Wow. Go. So you can see here, like starting out here with this type of breath, and then we keep practicing here, slowing down the breath a bit, making it nice and smooth. We're tracking the heart rate. So doing a little bit of training in the room so people can see what's happening in the body. How about thinking about headache and migraine? So how many people in the room have heard of something called cognitive behavioral therapy, or CBT? Great, most people. So I won't go into the great details of it, but I'll give a couple of examples, and then we'll work on it in the afternoon in kind of a discussion kind of way. So I'll just start by giving an example. The idea behind cognitive behavioral therapy, it's a theory that we use in all sorts of psychology, anything like anxiety, depression, any sort of stress management, pain, headache. The basic idea is that our thoughts, feelings, and behaviors are all interrelated. It's really hard to just change your feelings. I can't say, hey, you turn that frown upside down, don't be sad, don't be angry. What we can work on is changing some of our thoughts, some of our behaviors, what we do, and maybe affecting some of our feelings. And when I say feelings, I mean emotional and physical feelings. So for instance, if you have a new headache while at work, one of your thoughts might be, this is examples that I hear from patients regularly, you know, the whole day's ruined now that my pain flared up. And that makes sense because maybe you've had experience where this happened before. What someone might do is say, you know what, the behavior, I'm going to leave work early, I'm going to cancel dinner plans with my friends, and get out of here. Leads to some feelings like anger or worry, hopelessness, increased muscle tension. But what if we thought something just a little bit different? We say, I can take a rest. I can see how I feel. I have had headaches in the past that didn't turn into a full-blown migraine. I have had headaches that didn't last as long. It may be only partially true, but if we have that thought, we might be able to do some of the behaviors that are helpful for us. Maybe like a relaxation exercise, maybe even keeping those plans and staying at work and just taking a 30-minute break from work and seeing what happens. And we might have a different emotional and physical experience. We might feel, instead of very worried, we might feel only somewhat worried. We might actually feel some amount of confidence or empowerment. We might notice decreased muscle tension. As we know, muscle tension can, as Dr. Levin talked about earlier, neck tension, jaw, can really feed into a migraine cycle. And so I'll just share one of the common things, this is actually from pain psychology, one of the common unhelpful patterns, it doesn't mean it's wrong, but it's not always helpful pattern of thinking. We call it pain catastrophizing, which is kind of a mouthful, but what we mean is expecting the worst will happen in relation to our headache and pain. So for instance, you start getting some of those prodromal symptoms. You might start feeling a little bit of extra tension coming on, a little bit of light sensitivity, and you think, this headache will never get better. It's only going to get worse. At this rate, I'll lose my job and I'll never work again. I know when I experience pain, sometimes I jump to this as well. It doesn't mean it's not true. I hope it's not true. But having these thoughts doesn't always help us in the moment. And that's something that we do work on in cognitive behavioral therapy. But there's actually some quick tips and tools that don't even have to go to therapy for. But really the takeaway from this is what you think can affect how you react and feel emotionally and physically.